Nearly 100 members of Congress reported stock trades that overlap with committee work. Violence against nurses worse than ever. Only 12% of Americans think the U.S. healthcare system runs well. U.S. calls for an immediate end to hostilities on Azerbaijani-Armenian border. Rights advocates condemn UK's crackdown on anti-monarchy protesters. India places Hindu idols in Kashmiri Muslims' prison wards. From Washington, D.C., this is the Muslim News on Muslim Network TV. Assalamu alaikum, I'm Hena Zuberi. Our top story tonight. On Tuesday, a leading government ethics watchdog renewed calls to ban members of U.S. Congress from trading stocks while in office. Citizens for Responsibility and Ethics called for legislation that would ban congressional stock trading. The statement comes after a recent New York Times investigation that found nearly 100 U.S. lawmakers reported trades in companies influenced by their committees. In some cases, the trades involved the legislators' spouses or dependent children. Democratic Senator Elizabeth Warren agreed with the watchdog statement. She tweeted that it's long past time to ban members of Congress and their spouses from owning and trading individual stocks. In the United States, 2 nurses are attacked every hour. On average, 57 nurses are assaulted every day. Press Ganey's National Database of Nursing Quality Indicators showed that from April to June this year, over 5,000 assaults occurred at more than 400 facilities. Nurses face the highest number of assaults in psychiatric units and emergency departments. Advocates for nurse safety say violence against nurses isn't new. Gerard Brogan is the registered nurse and director of nursing practice at National Nurses United. He said there are few protections for nurses. He also said that many of the stresses on the female-dominated profession were amplified due to the pandemic. Roughly 2/3 of U.S. adults think that the federal government's responsibility is to ensure that all Americans have health care coverage. New survey data released Monday shows only 12% of Americans think health care in the U.S. is handled extremely well or very well. The new Associated Press NORC Center for Public Affairs research poll finds 56% of the U.S. public believes healthcare is handled not too well or not well at all. Meanwhile, 32% believe healthcare is handled somewhat well. Roughly 30 million Americans are without healthcare insurance. This is contributing to the country's dramatic decline in life expectancy. A Pennsylvania gubernatorial candidate can be heard on a recorded Zoom call praying with Christian nationalists for the January 6 insurrection to succeed. Doug Mastriano, a right-wing state senator who won the Republican gubernatorial primary, held up letters to Mitch McConnell and Kevin McCarthy during the call. He said former President Donald Trump had personally asked him to tell them about alleged fraud in the state's election. Mastriano urged Congress to disregard the 2020 election results. He also invoked the Book of Revelations to pray for the insurrection to succeed, Rolling Stone reports. The call took place between the November 8, 2020 election and the January 6, 2021 certification of Joe Biden's election. The U.S. Food and Drug Administration authorized an updated COVID-19 vaccine to effectively combat latest variants. The combination vaccine from Moderna and Pfizer-BioNTech is designed to attack both COVID-19 and Omicron variants of the virus. Millions of doses are being shipped nationwide. The Omicron variant is more transmissible and has led to multiple subvariants. Dr. Uzma Sayed is a New York-based COVID-19 specialist and infectious disease physician. She told American Muslim Today that health officials are preparing for a possible surge in cases this fall as immunity wanes. Health officials are also anticipating a higher incidence of flu this year. The Moderna, Pfizer, BioNTech vaccines are authorized as a booster dose for those who have had initial doses. People 18 and older can receive the Moderna booster. Those 12 years and older are eligible for the Pfizer-BioNTech booster. Indianapolis police found the body of a 55-year-old Muslim man, Abdul Qadir Filanwa, with gunshot wounds inside a cab Saturday morning. Shortly after 4 a.m., police responded to a call of a suspicious cab parked with the door wide open. Filanwa was pronounced dead at the scene. Ahmed Al-Amin, Imam and Director of the Indianapolis Muslim Community Association, said that the death has been shocking for the Muslim community. Filanwa came to America after fleeing war-ravaged Somalia. Al-Amin said, like many Muslim immigrants, Filanwa was working as a taxi driver to provide for his family back home. The U.S. calls for an immediate end to hostilities between Azerbaijan and Armenia. Details after the break. Stay tuned, and we'll be right back after these messages.
A free 3-minute online chat can give you the personalized tips you need to start boosting your retirement savings today.
I am what hunger looks like in America.
My wife, she's a professor at the University of Cincinnati, who's Catholic, and by her watching and listening to our 3-year-old son watch Adam's World, she ended up taking Kalima Shahada. She embraced Islam because she learned so much about Islam and the other prophets. It really affected our life in a great way, and because of Sound Vision and Adam's World, we're Muslims.
I took my Shahada 15 years ago, and I actually am from a rural part of Ohio. And so I found the catalog for Sound Vision, and I ordered the tapes and the CDs and the books, and I used those, and especially for my little daughter, that's how we basically learned our Islam, and Islam entered our hearts through the wonderful works of Sound Vision.
Okay, assalamu alaikum, brother. I just want you to know that I love the Sound Vision website, that a lot of times when I'm looking for information, especially as it relates to homelessness, domestic violence, and women issues, I go to that website, and then I see what you've written, and then I copy and paste it, and spread the word, because the wisdom is there, so I can't do any better than what Sound Vision has already done.
Sound Vision is our survival guide. It is the organization that provides skills for Muslims how to survive and thrive in this community here in the U.S.
Assalamu alaikum, my name is Anam, I'm in 11th grade, and I grew up with Adam's World, and what it taught me was unity, respect, and love for the Muslim Ummah.
Adam's World is the greatest show ever made. Take me to the Kaaba, man. I love that puppet.
To stop this genocide, we need your help.
Welcome back. U.S. Secretary of State Antony Blinken called for an immediate end to military hostilities between Azerbaijan and Armenia after border clashes. Blinken expressed concern about reports of attacks along the border. That includes strikes against settlements and civilian infrastructure inside Armenia. He stressed there can be no military solution to the conflict. The Azerbaijani Defense Ministry claims that the Armenian military carried out extensive provocations in border areas. The ministry said Armenian army saboteurs laid landmines between the position of the Azerbaijani army in various directions. As a result, intense clashes have broken out between the troops of both countries, with military casualties on both sides. A newly elected Muslim cleric of the Turkish minority in Greece's Western Thrace region claims discrimination practices against the group. Mustafa Trampa was elected as the region's new mufti on September 9th. He told Anadolu agency Greece has violated the fundamental rights of the Turkish minority. Trampa stressed that those were protected by treaties enacted in 1920 and 1923. He said the community is in uproar over the unlawful dismissal of our muftis. Trampa added that community members are opposed to a mufti being appointed without consulting their advisory board. Since 1990, the minority community has been electing its own mufti as specified under the treaties and laws. India has installed Hindu idols in prison wards of Kashmiri Muslim political prisoners as a torture tactic. On September 14th, family members of Muslim Kashmiri political prisoners held in New Delhi's Tihar jail told Muslim Network TV jail authorities have installed Hindu idols in the wards. Family members claimed when Muslim prisoners recite the Quran or perform prayers, Hindu hymns are recited out loud to torment and disorient them. Relatives of the prisoners said these colonial practices show how Islamophobia is at the heart of India's occupation in Kashmir. Palestinian Prime Minister Mohammed Shataya on Monday accused Israel of seeking to destroy the Ramallah-based Palestinian Authority. Shataya told his cabinet members Israel continues its efforts to destroy the Palestinian Authority and undermine its institutions. That contradicts Israel's claims that it wants to strengthen the position of the Palestinian Authority, he said. In 1993, the Palestine Liberation Organization and Israel signed the Oslo Agreement. It gave Palestinians a form of civil rule. Negotiations between the two sides failed to reach an agreement and create a Palestinian state. Peace negotiations between the Palestinians and Israelis collapsed in April 2014. Israel then refused to stop building settlements and release Palestinian detainees imprisoned before 1993. Alaa Abdel Fattah, a British Egyptian activist and blogger, has been on hunger strike for nearly 6 months, protesting his detention. The 40-year-old is an icon of Egypt's 2011 revolution and pro-democracy movements. The Guardian reports that he has told family members he may die in prison. Abdel Fattah has been in detention for the past 35 months. This is for the peaceful exercise of his human rights, according to Amnesty International. Abdel Fattah and his lawyer, Mohammed Bakr, were arrested in September 2019. They were sentenced last year by Egypt's Emergency State Security Court for spreading false news on social media. Proponents of free speech warn that UK law enforcement agents appear ready to curb citizens' rights to freely express views about the monarchy. Several arrests have been reported at events during the 10-day nationwide mourning period following Queen Elizabeth II's death last week. Critics of the monarchy have been detained, forced to leave public areas, and intimidated by police officers in Scotland and London. Tensions are flaring as Queen Elizabeth's coffin has traveled across the UK, along with members of the royal family, including King Charles III. The first arrest was reportedly made in Oxford. Simon Hill said Oxford police officers placed him under arrest for asking who elected Charles as his mother's successor. He was detained under the Police Crime Sentencing and Courts Act 2022, which has been condemned by rights advocates. Coming up next after the break is our in-depth analysis segment. So stay tuned and we'll be right back after these messages.
If I could be you, and you could be me for just 1 hour. Walk a mile in my shoes. Walk a mile in my shoes.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
If I could be you, and you could be me for just 1 hour. Walk a mile in my shoes. Walk a mile in my shoes.
Greetings of peace. Assalamu alaikum. My name is Dawood Warnsby. About 30 years ago, I walked into a mosque for the first time here in Canada, and I felt pretty strange. The reason I felt so weird? Well, in those days, it wasn't easy to walk into a mosque and find someone else who was a shaggy-haired singer-songwriter who wrote poetry and worked professionally as a puppeteer. I had no idea how I was going to fit in culturally or creatively with this new community. I quickly realized that there was a long and rich history of arts in the Muslim community that went hand in hand with education and learning. A little while later, I came upon a magazine from an organization called Sound Vision. And they had a little blurb at the back of the magazine that said, if you're creative, we'd love to work with you. I took some songs that I'd been writing, put them on a little cassette and called them A Whisper of Peace, sent them through to Sound Vision. I had no idea that over 25 years later, I would still be working with Sound Vision. Things have really changed over the last quarter century. Now we see tons of creative commercial Muslim artists making music and videos and film and television and comedy and cartoons. It's wonderful. But sadly, we're also still seeing a lack of educational materials for young children. Sound Vision continues to be one of the only non-profit media producers creating quality educational content for Muslim children and families. Children need mentors and teachers who are able and willing to help inspire them with wisdom, self-esteem, and care for their world. The Adam's World series has been rebooted as an app with new episodes and new songs. We have the popular Adam's World Club and the Colors of Islam classes for children and youth to attend online. And now there's a new program in the works called Falafel Dude, helping school children learn to be better citizens, better neighbors, and better Muslims. Join me in supporting Sound Vision's ongoing work however you can, so that we can continue to inspire Muslim children and families for generations to come. Assalamu alaikum.
To stop this genocide, we need your help.
Welcome back. Let's watch our in-depth analysis segment.
Thank you, Hena. Now we move to a discussion of an issue that impacts every single person living in this country, and that is healthcare. What do the American people think of our healthcare system? This is an issue that we have discussed and debated for decades in our country, and that discussion is still ongoing. And there's a new poll out that gives us an understanding of what the American people think about their healthcare system, especially in the wake of the pandemic. To discuss this issue, I'm happy to welcome back a very special guest, Dr. Jim Kahn. Dr. Kahn is a professor of health policy at the University of California at San Francisco and an editor and blogger at Health Justice Monitor. We're very happy to have him with us. Dr. Kahn, good afternoon. How are you?
I'm doing okay. Thanks for having me on.
Thank you so much for joining us. So, Dr. Kahn, I want to start by asking you a question that is perhaps a somewhat easy one for you, but a lot of viewers may not know this. What are the major differences between the American healthcare system and other healthcare systems around the world, in particular in Europe, for example?
Well, the big difference is how we pay for healthcare. In the United States, we have a highly varied patchwork of health insurance. We have a lot of people covered through private insurance, usually obtained at work. We have a wide variety of public programs such as Medicare and Medicaid and many others. And there are quite a few people, about 10%, who are uninsured. And then another major difference is that for people who are insured, the cost sharing requirements, that is deductibles, the amount of money that people need to pay at the beginning of the year before the insurance even kicks in, can be quite high, $2,000 to $5,000. Plus, there's all sorts of cost sharing even after the deductible. And so as a result, you have a variety of very different health plans. Again, some people uninsured, and the cost sharing is very substantial. This is very much in contrast to other wealthy countries, such as in Europe, Australia, many parts of Asia, where everyone is covered with a single coverage plan, a single benefit mix that's applied across the board and has very low cost sharing. This is a huge difference in day-to-day access to healthcare. Everyone has equal and excellent access.
Dr. Kahn, thank you for that summary. That's a complicated issue, and you summarized it very quickly and shortly and concisely for us, so we appreciate that. Now, moving on, what do the American people think of our healthcare system? I understand there's a new poll out about this issue. Can you give us some of the highlights?
Well, we already know from past work that Americans are dissatisfied with health insurance compared to how citizens of other countries, other wealthy countries, feel about their health insurance. There have been comparisons going on for many years. But what's new about this poll is that the level of frustration with the health system and with health care is really, really high. For example, the poll asked, how well do you think your healthcare in general is working? And more than half, 56%, say that it's working not well or not well at all. And in contrast, only 12% thought that it's working extremely well, and another 32% said that it's working somewhat well. So again, the majority are highly dissatisfied with how healthcare is working. And that's partly because doctors and nurses are stressed out these days after COVID, but it's mainly because of the insurance barriers that people have to getting healthcare. The results for other kinds of care, like mental health care and nursing homes, is even worse. People are more frustrated in those areas.
So, Doctor, can you tell us more about that, about why people have these negative feelings, and what are those insurance barriers and difficulties that have led people to experience problems and then have a negative view of our healthcare system? What are some of the issues with the insurance system?
Well, you can imagine, let's say it's January, your new coverage year, and you don't feel well. You'd like to go to the doctor, but you're still very much in the deductible period where you know that all expenses that you pay to go to the doctor, go to urgent care, go to emergency department, all of those expenses come out of your pocket. And so you do a calculation and you say, well, am I willing to spend $150 to see the doctor, possibly more with tests, maybe several $1,000s to go to the emergency department? It's like, I don't feel that sick. I think I'll tough it out. Well, that's just a terrible choice to have to make. And as a result, lots of people skip or delay care because of financial problems. And for the people who do feel like they need to see the doctor, understandably, they're sick. If you look at the rates of medical indebtedness, about half of the U.S. adult population has medical debt. The average is $2,500. Half have medical debt, and medical bankruptcy, when the situation gets really dire financially, is extraordinarily common. It's over 700,000 per year. So you have this terrible choice of either not getting care or getting care, and because of the cost sharing, going into medical debt. And the people in medical debt, it's not just a payment they have to make every month. They're foregoing other important things like education, good housing situation, and many other things. This is a real compromise to their quality of life. And of course, then they're frustrated about how insurance has created this terrible dilemma for them. And take that for themselves and multiply it even more if it's about care for their children. Of course, people are extremely worried about care for their children. And then the psychological toll is magnified.
Now, doctor, if I can ask you this off the top of my head, other people, have you ever had occasion to try to explain the American health insurance system to Europeans? And if so, are they confused when you have to explain to them copays and deductibles and caps and out-of-cost pockets? Because I think for many Americans, we're so used to this system, we're numb to it. But I just wonder if you were an alien from Mars learning about the system, you might go, "This is indecipherable. This is insane." I don't know. Have you ever had occasion to hear what other people think of our system, trying to make sense of it?
Yeah, it's funny. I've had two types of interactions. I talk a lot to health policy experts in Europe, and they know about the problems here, so they're not surprised or confused. They just roll their eyes. They just can't believe we do it this way. They just are stunned every time. They know it. They know it's like this, and they're just stunned. But as a patient, I've had emergencies in several foreign countries where I needed to go in and get a broken toe fixed and that kind of thing, and then at the end, I go, to the doctor or to the business office, and I say, "Well, how much do I owe you, and how can I pay?" And they look at me and they go, "Oh, no, it's covered." Or they say, "Well, there is this $20 copay that we're supposed to ask for, but it doesn't really seem worthwhile." So those are the people who are baffled that I would be, after getting care, that I would be thinking about payment issues.
That's fascinating. I was curious about that. Very fascinating. So, Dr. Kahn, next question. So, what is the solution? I understand you're a supporter of the single payer system. Tell us about that. And is there anything, given the politics in our country and the difficulty making that happen, is there anything in the short term, short of that could be done to make a bad situation less bad?
Well, I am very much a single-payer supporter, and if you look at what all the other countries do, we just completed a study of 33 other wealthy countries, and every single one has universal coverage with a standard benefits package. So everyone's covered in the same way with minimal financial responsibilities for the patient. And there are other advantages, such as for doctors, like there's a single drug formulary, so they don't have to juggle all these different drug formularies, and they get paid the same for whichever patient they see. Whereas here, a doctor might get $15 for a Medicaid patient and might get $150 for a private patient. That's very confusing and distracts people from clinical care. And so single payer is the best way in the United States to get that kind of a system. Again, universal coverage with the same benefits for everyone. Public support for single payer, depending how you measure it, is about 2/3. If you ask people, would you like the government to pay for your healthcare? If it meant that you'd pay more taxes, but your premiums and deductibles and out-of-network denials and all of that would go away, everything would be paid for, you just have to pay more taxes, then about 2/3 say that that's what they would like. Unfortunately, this kind of support isn't yet reflected in the people who are in a position to implement single payer, like our legislators. Currently, the House bill for single payer, with the primary sponsor, Pramila Jayapal, has 120 co-sponsors. Not bad, but not enough to pass the bill. And Bernie, of course, has a bill in the Senate. I'm an optimist. My view is this accumulating evidence that A, people don't like the problems we have with our current insurance, and B, we continue to pay more, sometimes twice as much as other countries, will lead to a crisis that will lead to the kind of change that we deserve, which is to have a good health insurance system.
Last question for you, Dr. Kahn. Would it be possible, while that fight is going on for single payer, would something like, for example, let's say the government were to set up a fully functioning government-provided healthcare system, not in place of private insurance, but to compete with private insurance. In the short term, would that do anything to help, or does that just reinforce a bad situation?
Yeah, it doesn't work very well. That was tried to some extent under the Affordable Care Act, where there were some community options on the health insurance exchanges. But the rules that were set up under the influence of the private insurance industry were very unfavorable, and all of those plans collapsed. So it's hard to do that in a fair way, and it doesn't address the issue of terrible inefficiency and inequity. So with a separate government system, there'd be different payment rates. Everyone would have different rules. And typically poor people would continue to come out with worse quality insurance. We have Medicaid for the poor, but I just wish that we didn't have the phrase health insurance for the poor. I think everyone should have the same health insurance. The one thing I think would be a good short-term step is to go to traditional Medicare, which is a good government system, and add an out-of-pocket maximum. Right now, people in traditional Medicare are at risk of an unlimited amount of medical expenditures if they get really sick. And that would be an easy fix for the government to just say, we're going to cap that obligation. But beyond that, I think we've tried for decades to add one fix after another, including the Affordable Care Act. And they don't work because the system is fundamentally dysfunctional, it's unfair, it's inefficient. And I just don't see the point. I think it's time to do what 33 out of 33 other countries have done, is do something where everyone's covered with the same insurance, and it simplifies everything for everyone.
Dr. Kahn, I want to thank you so much for sharing your perspective, educating us about these issues, and letting us know the latest developments and what the American people are thinking about their healthcare system. Obviously, this is an issue that doesn't look like it'll be resolved overnight, so we expect to have you back on, hopefully to discuss some positive progress, God willing. Thank you so much for joining us, Dr. Kahn.
Thanks for having me on.
Thank you. And we'll send it back to you, Hena.
Thank you so much. That's all from our Washington studios tonight. Thank you for tuning in. You can find previous episodes and more on our YouTube or Facebook. For more content, keep watching Muslim Network TV or visit muslimnetwork.tv. Assalamu alaikum and good night.